Thank you so much, Theo, and hi everyone. Lovely to meet you all. My name is Clarissa, and I am a UX researcher currently based at the National Institute for Health and Care Excellence, aka NICE. I work in London, and today I'm going to be talking about a subject that it's kind of been marinating in my mind since I transitioned to UX from academia, and it's about kind of what can we learn from academic research, and how can it support and champion innovation in healthcare. So in this talk, I'm going to be discussing what I found was some quite interesting perceptions of what academic research is that made it quite challenging for me to kind of transition from that field into where I am now. Then I'm going to talk about my reflections on the relevance of academic research to UX. And then I'm going to briefly talk about my experience of conducting what I feel was UX research, but in an academic setting. And then I'm going to round off with some of the key reflections that I've had about what, from my time in academia, I want to translate into my current role as a UX researcher. So, one of the first things I wanted to open up about was the kind of perceptions that I had to deal with when I chose to transition out of academia into UX. So just for further context, I found out about UX research prior to joining the academic institution that I was based in. I knew it was a field that really spoke to me in the intersection of research and design and information gathering, that sort of thing. But it was obviously very difficult at that time for me to get into a dedicated user research role. So I went into academia and thought it'd be a great way to kind of learn some skills that I could apply to my first titled UX researcher role. But one of the main things I found quite challenging when I tried to transition out was that most of the people that I'd speak to, whether it would be other people in the field, recruiters, hiring managers, most of them seem to kind of think that you just spend your time in academia pondering and just thinking and just not really doing any work that has any resemblance to what's thought of as UX work or working in Agile. And some of the things that I heard from people was, people who work in academia are really slow. It takes them forever to do anything. If you come from academia, there's no way that you can work in Agile. Academic work, it's all about theory. It's not about practice. And we're in the realm of practice. We want to, create real life solutions. There's also some things about, in the commercial world, it's very different. And if you're in the academic world, you're in your own bubble. You don't know what's going on in the real world out there. There's it must be really difficult doing work in academia because of all the bureaucracy and the politics and all that stuff. It's not like that outside of academia. And I think it was really challenging to kind of come across these very general perceptions because my experience of academia is very different. And I think it's because I was working specifically in the digital health space. And in that space, I feel like the bridge between what's traditionally considered as academic research and the commercial world is really narrowing. And I think it's mainly because there's been such a push for digital transformation in healthcare, and it's really been a team sport, so to say, collaborations between people in the healthcare space, like healthcare professionals who are kind of venturing out and creating their own tools. There's also been collaborations between commercial entities and academic institutes. There's a real if you look online and look at digital research and digital health research in academia, you see lots of networks and organizations that are really set out on bringing those different disciplines and fields together. And I think it really works because digital transformations been affecting every sector, but I think in the healthcare space, the problems that we're trying to address through digital transformation are so complex and they're intermingling. If you come up with an intervention for weight management, that has implications on, diabetes management, or, how do you solve issues around efficiency in a healthcare system without considering the fact that, maybe measuring time has very different implications for, I don't know, but like it's a difficult thing to think about, how you kind of solve the actual issues that the healthcare system's facing. Innovation as well cannot come at the cost of clinical safety. So academia is looked to kind of establish ways in which you can kind of get answers as to whether a solution is going to work without it, negatively impacting the system. There's also a big push to generate evidence of the clinical and economic impact of digital health interventions. And as well, alongside that, how do you kind of generate that evidence in a way that's safe and reliable, and involves real users? And I think as well, the point of these sorts of collaborations and initiatives like NHS Digital Academy and all that stuff is that we want to get to a place where academic research and commercial research kind of go in tandem rather than one lagging behind, which is often the case with academic research, is perceived as lagging behind. But really, we're moving forward in a way that we're collaborating together to ensure that innovation and the evaluation of those innovations keep at pace. So what does it all come down to? What we're reflecting on today? Does academic research have any relevance to UX? Yes, I think so. And this is one of the things that I try to challenge people when I was transitioning out of academia, which is that a lot of the disciplines, such as cognitive psychology, mechanical engineering, human factors engineering, and many others have informed a lot of the principles and methods that we use as UX practitioners. So I think it's kind of crazy to almost look at academia as this thing that's kind of been, can hold you back. Even now when we're, UX is booming, there's more professionals than ever working in this space. To ignore all of the foundational work that's informed our discipline, I think is kind of bonkers. And I think what really it boils down to, and this fear and almost in some circumstances disdain for academic research, is the word academic. What does that mean? I think the word itself can, you think about very old institutions and, a really high threshold of quality that can discard people who can contribute to the field per se. And I think the way I've tried to reframe it is that academic research is about doing thorough investigations and reflections within your field. You don't have to be someone who works in a university or an institute to be academic. It's about, almost enjoying the obsessive thinking process of like, what can we do to uncover the problems that we're facing, and what kind of methods can we use, and how can we tweak those and adapt those to contribute to the field in a meaningful way. It's also about critical thinking. I think critical thinking is such a great skill that you build in your educational journey, and it's one that ensures quality control. It ensures that you're kind of really diving deep into problem spaces. That's a great thing to foster and to encourage and to look for when you're hiring people to fulfill these roles in UX. And as well, I think a big part of academic research is contributing new knowledge. How many times have you read Medium articles that say the same thing? It's just a regurgitation of someone else's posts. The purpose of publishing work in academic journals is that you're purposely contributing new knowledge. So again, I think there are so many great skills and great things that we can learn from academic practices, which don't mean that you're speaking to old ways of thinking or slow ways of thinking, but there's a lot of, creativity and how do I say, like fun investigations that are also a part of academic work that we can translate into UX, I think. So what I want to do is briefly kind of talk about my experience working in academia, just again, because I feel like, I don't know if anyone else relates to the experience that I had or anyone had a very different experience. But again, I think that my reflections on kind of what I've learned from my experience in academia are based on the fact that I was working in a very unique space. So I joined the Institute of Global Health Innovation at Imperial College London probably about 4.5 years ago as a research assistant in what was called the digital health team. So I joined at a point where they as a team, were looking to partner with commercial organizations. So for example, like Roche, AstraZeneca, and startups like My Way Digital Health to conduct research into digital health interventions, which informed what they call like the evidence behind their adoption. So if we get some digital health interventions and test them with real users, what can we learn about the impact that they could have in the actual real life space? So it was about kind of recognizing that lots of traditional methods for evaluating the efficacy of things like pharmaceutical drugs don't translate very well to digital health interventions because of the pace of innovation. So what methods could we use to uncover information about how impactful they could be in the real life system? So I'd say one of my key responsibilities was to evaluate the user research and evidence generation for those digital health interventions. But I also, as part of that role, working with the kind of wider team, did some work around co-production and co-design of community-based healthcare interventions with people who have lived experience of, like mental health conditions or respiratory diseases. And so it's kind of like a fun intersection of, I guess like design thinking, but also kind of, usability testing. And I kind of just want to summarize my day-to-day responsibilities, because again, I think when you're outside of academia, in the perceptions that you kind of build, often, it's hard sometimes to kind of see how roles that people have in that space kind of translate to the roles that we have in UX. So I was at a very high level say that my role was to kind of understand or help teams, innovators in lots of different spaces, understand what is the problem that needs to be solved. Going further down the kind of product pipeline, are we solving an actual problem? And then kind of finally to round it off at the kind of evaluative stage, how is the solution going to impact the system? So almost going beyond the kind of, for example, design of the solutions to understand, okay, if you actually put it into a healthcare system, what impact does that have for commissioning for other people who don't primarily use the solution? So in terms of my day-to-day work, it kind of is similar to what I do now. So I was working with people in the product development teams, or I was working with lay members to understand what the scope of the project should be, and what the aims and objectives are that we're trying to work towards. I was responsible for identifying appropriate research methods. That's a very fundamental thing about academic research. There's so many ways that you can go about solving a problem. Which ones do you choose? Which ones do you adapt? I also had to obtain ethics approval, and there's a long-standing process for doing that. So I had to ensure that what we did kind of, met the ethics approval standards of the organization, but also that we made sure that we were thinking about kind of safeguarding measures and all that sort of stuff to ensure that people felt psychologically safe to take part in this research. I was responsible for recruiting people. And in many ways, it was actually easier for me to do this for my clients as an academic researcher. Some of my colleagues were clinicians, so we could make use of networks that we had. Also, the university that I worked for was affiliated with an NHS trust. So again, it was very straightforward for me to do that, and then to carry out and receive informed consent from participants. I was involved in designing scenarios and tasks to test the solutions and concepts with real users. And I had to feed back those findings to the product development teams and implementation teams, of the clients. So, in many ways, I feel like there are a lot of things that I could translate to my current role. What I wanted to do now was to give you an example of one project that I worked on. I wasn't sure how detailed to go into this because I wanted to save time for the Q&A, and I can go into it a bit more. But this was actually the first paper that I published about this work as a lead author. So it's the one that I'm really proud of. And essentially, it was quite a big study that we did over a couple of months on an online clinical decision support tool developed by Roche. Again, I can talk about this because this is, you can read the paper. It's publicly available to look at. And what this was is, I designed this study to conduct in-lab, or what we call simulation-based research, testing the usability of this tool with about 60 healthcare professionals. And it was a really exciting piece of work using lots of methods like, simulating clinical scenarios that people would use to test the tool with. We did things like testing the cognitive load of the tasks, using street task tests. So yeah, it was a really fun piece of work. And again, this is the reference if you want to read about it. But it was really enlightening to me as kind of how even though my role was a research assistant, I was conducting research with real life users or target users of this solution, and helping the product development teams understand how to develop it further so it meets their needs in a more appropriate way. So again, it was kind of an interesting reflection from me about how I kind of use that experience to transition into my first titled UX research role. And I have to say, even after that process, it still was a culture shock for me when I landed in my first user researcher role, because I realized that the ways of working are very different outside of academia. And in some ways it's kind of helpful, in some ways it's great, but in other ways I felt like there was like some missing pieces about how we can really enhance our work as UX researchers by adopting some ways of working from academia. And that's what I want to briefly touch upon for the rest of this talk. So the first thing I thought that I could bring from my experience working in academia was making sure that we thoroughly document our research process. The second, having a bit more capacity to research our methods. And the third, and probably the most crucial thing, ensuring ethics and safeguarding is thought about throughout our work. And I'll just go into detail a bit more about them now. So the first one, documenting our process. I remember when I joined my team in my first role, and I think one of the first questions I said was, can I have a look at the previous research protocols that you've used, or that you've saved somewhere in your hard drives? And the team were very open and honest with me, and they said, there's some bits here and there, but we generally don't have. We have a template of some kind, but we don't have a process where we document, everything that we're about to do for a research project. And I think this is a very common thing, no judgment at all. But I did kind of think to myself, one of the great things about having a research plan, and this is a screenshot of one that I created or adapted, sorry, from one of my colleagues, is that it really helps ground everyone in a team as to what we're going to do. Because I think one of the challenges you have sometimes when you're working in quite a multidisciplinary team is everyone's got different angles on a project. So I find that actually having a research plan is a great way to kind of set out what the expectations are. What are the aims, objectives, research questions? What's the scope of the research, including what's out of scope as the research? What's the study design and methods that you're going to use? Are there quite novel methods? Do you want to go into detail about, why we're using them? And then, what's the intended outputs and what should be the outcome of this research for users, but also for our learning as a team. And I think it's a great North Star to have. And whenever I was working in academia and I was working on a project and, it gets to a point where it's like week 6 or 7 or something, and you think, why didn't we do it this way? And you kind of go back to the protocol, which is what we would call it, and go, oh yeah, that's why. So I always thought like, moving forward for me, that definitely is something I'd like to keep from my time in academia, having a plan and having it written down. The second thing I think it's more of a difficult one for me to explain, but essentially, I have this book called The Universal Methods of Design. Don't know if anyone else has this book, but I love it because it really opened my eyes about the diversity of UX methods. But it's got lots of methods detailed at a very high level. And I think sometimes when you're working in this space, you kind of want to there's some methods you want to use, but you think it might be a bit more challenging to apply based on the kind of project you're doing. So, for example, I was working on a project recently where we were testing layouts or different components that we could use to present content about what to do if someone's been diagnosed with breast cancer. And so I had to think to myself, how do I create a scenario in which someone has to test this page without while being sensitive to the fact that they're looking at stuff that, their relatives might have had breast cancer, or we might be presenting something that's not quite correct to them. So we've got to be very mindful of that. As well, like some methods might seem like an appropriate one, but, COVID has shown us that sometimes, we need to explore remote options for research for people's safety. Like, COVID is still something that some people are very conscious of and concerned about. So some methods that we have written down as good to conduct in person need to be adapted for remote research. And other things like just being mindful of the kinds of user groups that we're speaking to. Like if we're doing research with people who've maybe had a brain injury, or people with certain disabilities, or even healthcare professionals who are overburdened, some of the methods that we might want to use might be a bit just too much. So I think for me, there's something about kind of experimenting and tweaking methods, but also sharing that with the wider community. That's something I really liked doing, coming up with different, or just investigating the applicability of different methods in different settings. I think something that's really great to take away. And then I think the last one's a pretty big one, and I don't want to be one of those people who, wags their finger and go, ethics and safeguarding is really important. But again, for me, a bit of a culture shock that I could essentially design a research plan and just go ahead and do it. And there's no sort of accountability, let's say, about, have I considered the ethics and safeguarding of the project? And I guess one of the key things I want to take away is that, or key things I want to emphasize on this point is you never know what aspect of your research would cause harm. I'm trying to think of some examples that I could give on this specifically, but I think when you're working in the healthcare space, like I was talking about the breast cancer example, you've got to be really mindful of, so one project I worked on was a risk prediction tool that used some sort of like machine learning algorithm, and it presented users with their risk of developing complications from type 2 diabetes. So, we were charged with testing this tool with people who actually had diabetes, but the algorithm wasn't 100% working. We were more testing the layout of the web page that would present the real life content. So we were using, mock data for this. And we had to be really careful to reiterate to users in the testing, this is not your data. Please don't read into this and think that your diabetes is out of control, because it's fake. We're just testing the layouts here. So that's just one example where I feel like, if I was working on a project now, I would really want to sense check with my team what potential harm my work could cause that I might not be thinking of myself. And on the right is just a screenshot of a really lovely article from the Home Office where they've established their own sort of user research ethics board. You can read more about it here, but I think it's another great kind of reflection and learning from academic research, where you can use these things not as like a way to stop you from doing research, but just to sense check and make sure that you're not causing harm. So I just want to put that out there. Again, I don't want to harp on about ethics and safeguarding, because lots of great people who are way more experienced with me have been talking about this for a very long time. So just to round this off, because I want to save as much time as possible for a little chat, how can these learnings support innovation in healthcare? And I think if there's anything I want people to take away from this, is that an academic approach to UX doesn't have to be stifling. It really can just be about supporting better documentation practices, inspiring creativity and curiosity about UX methods, and lastly, ensuring ethics and safeguarding to create psychological safety and enhance trust. So that's all my slides. Any questions or comments? I see a comment in the chat from Claire Hamlet. Thank you, Claire. This is so true about the assumptions made about academics and academia. Yeah, I didn't find the pace overly different, especially when in academia, research grants have a deadline and you're expected to write lots of reports and papers that may never be read, but that's a different story. Exactly. That's, again, one of the funny things I found. And in my interviews, I was able to give examples of, how I kept a project to time. And that was one of the key factors for a project I was working on. It was during the pandemic. And we'd gotten approval to do this research in person. And then during the pandemic, we had to come up with a contingency plan to do it remotely, literally because we could not push the deadline of that project because the funding was running out within I think it was the third lockdown that this was happening. So yeah, there's a lot of similarities, I think, between those environments. I think the language that's used is very different, but the problems and challenges that we face can be very similar.
Yeah, thank you so much for that, Clarissa. Really appreciate it. That was a fantastic talk. Thank you to everyone. I think we're going to leave it there. If there's any more questions, we'll leave for a minute or so just for any questions. But I just wanted to thank everyone for joining us today. I think whether you've joined us from the US, or I know there was a few people from Hong Kong and Singapore that also joined, I think the issue that we face within healthcare is similar. Whether it comes to usability testing or research or writing, or even so much as the previous conversation we were having about recruiting doctors. I think that's a big one. And I think that's a huge one, especially in Europe, where time is money, and doctors, when they have their off time, can't be sitting in front of an app testing an app for you. So how do we get around that? I'm very open to discussions on how do you solve that problem? I mean, Clarissa, how do you solve that problem? Have you ever had that problem?
Yeah, so I was very fortunate in some regards because in my previous role, we were able to charge our clients to cover reimbursement for clinicians, which was great. But I think moving into public sector, I've definitely noticed the challenges around obtaining budget for recruitment. And I think for me, I've tried to ensure that the work I do put out is relatively low ask, and that even if we, for whatever internal policy, we can't reimburse professionals for their time, we make sure to share the findings with them, make sure to find opportunities to make sure that they feel like their time has been valued. Like sending thank you notes is a great way to do that.
Yeah.
And planning research, being mindful of things like strikes as well, something I had to come across recently, and the impact and uptake and scheduling that might have. So yeah, I think it's one of it's a big issue, I think, ensuring that people are reimbursed for their time. And again, why I think it's really important to be sensitive to that when you're trying to push for innovation in healthcare, because it does require people to test with. But if you're not reimbursing them for their time, then you're kind of adding to the problem.
True. And also that sort of magic number of how much do you reimburse you, that's sort of another conversation for a different time. Anyway, thank you, everyone. It was an absolutely amazing day.
Thanks, everyone.
Ciao.
Bye.
Bye.